Hello, my name is Rhett Simonko, and this is the Self as Leader Characterization assignment that will be evaluating my developing leadership traits, qualities, and behaviors that have been examined throughout this course. The goal of this presentation is to characterize my current style, reflect on shaping influence, and establish measurable goals for the future. Okay, so overview and professional context. So leadership is an advanced practice provider imperative. We assume complex leadership roles, integrate evidence and expertise, and influence health system policy. So for the advanced practice provider, leadership is a mandatory competency and should align with the highest standards set forth by national organizations. The National Organization of Nurse Practitioner Faculty's core competencies mandate that nurse practitioners assume complex and advanced leadership roles to initiate and guide change, as well as foster collaboration. The National Academy of Medicine has established effective care that requires the integration of evidence-based practice, robust research, clinical expertise, and patient values. The American Hospital Association aims to focus on systems leadership, in which it recognizes that advanced practice providers must be able to influence policy and practice in order to improve organizational and community health. So by adopting a leadership approach that is grounded in evidence-based practice and sincere patient engagement, I can uphold these national standards and consistently advance the quality of care I provide. Okay, let's take a look at my current leadership style. So I believe my current leadership style consists of elements of transformational leadership with a strong focus on supportive leadership. As a nurse practitioner, I'll strive to engage team members to think creatively about problems while utilizing intellectual stimulation. This is combined with the supportive leadership style from the Path Gold model, as I'll intentionally focus on fostering a friendly, satisfying environment that is attentive to individual well-being. As I examine and reflect on the big 5 personality factors, I've determined that I have low neuroticism, which means that I am geared towards being emotionally stable and am composed in high stress scenarios. So essentially, I align with servant leadership, in which I prioritize the growth and development of team members above my own needs. Combine these traits and leadership approaches will position me to lead with clarity, compassion, and resilience, while simultaneously empowering those around me to grow and to excel. Alright, so evidence-based financial decisions, we're looking at financial and ethical principles. So it is my duty, and I must practice financial stewardship and ensure that my clinical approach advocates for both practical and cost-effective care. This principle is in direct support of the NONPF competency that advocates for cost-conscious healthcare. In relation to my capstone project of evaluating the effectiveness of GLP-1 receptor agonists in non-diabetic overweight or obese patients compared to diet and exercise guidelines, I must carefully analyze whether this proposed intervention demonstrates a positive return on investment. And this fulfills the NONPF competency, which states that I must advocate for cost-effective care. And ethically, I will prioritize patient autonomy and ensure that my care preserves patient control over decision-making and incorporates patient cultural preferences. The NONPF competency of ethics requires that I integrate ethical principles in my decision-making and apply sound solutions. It is crucial that I adopt cost-conscious decision-making paired with ethical vigilance and respect for patient autonomy. So in doing so, I can ensure that my practice remains both fiscally responsible and grounded in patient-centered care. Okay, this slide will discuss cultural competency and trust, which address the principles of cultural and spiritual. So as a nurse practitioner, I must advance health equity through practice, as this can dramatically influence health beliefs, practices, and expectations. And one way I commit to this is by prompting the integration of patients' cultural preferences into my patient's plan of care. Active listening also helps me to avoid charismatic overconfidence risks that can potentially obscure and undermine patient faith. Our text discusses how active listening is key in building trust and rapport with our patients. So by strengthening my cultural competency and enhancing trust through active listening, I will be able to provide better care that is not only clinically effective, but is truly aligned with each patient's experiences and desires. All right, so mentorship and adaptive leadership. So a lot of my primary influences have stemmed from a mid-level provider that I worked alongside with as an RN. He was also a preceptor when I first started within the CCU. His name is Matt, and he's been a nurse practitioner now for probably around 5 years. But in recalling this scenario, I can think of one in which Matt demonstrated servant leadership perfectly. While working in the ICU, one of our CRRT patients developed acute hypotension while simultaneously requiring mechanical ventilator adjustments. This situation demanded clarity and prompt treatment. Matt took a few seconds to, quote, get on the balcony, end quote, and returned and engaged both respiratory and nursing, assessing what immediate non-pharmacological measures could be implemented at that time. The team worked together and devised an effective solution, which demonstrated servant leadership's wisdom and provided emotional stability to the team. And this has fueled a desire personally to remain composed under pressure. All right, let's look at peer feedback and leadership member exchange theory. One of my mentors who's still practicing as an RN today had once told me when I was performing charge nurse duties that I delegate effectively, but there are times when I seem like I hold back too much. And the main issue was that I was relying too heavily on the delegating S4 style, while some team members actually needed the coaching style, or S2 style. So this could have potentially risked creating an outgroup, so to speak, and according to the leadership member exchange theory, suggests that I delegate too quickly. So all this to say, by relying too heavily on delegation, I risk falling into a management by exception passive or transactional leadership, which is essentially waiting until failure to address performance. So by recognizing and acknowledging this pattern, I'm able to shift towards a more balanced leadership style that supports overall team growth rather than simply reacting only when an issue presents itself. Improving corrective feedback. One area in which I seek to improve my skills is in providing formal corrective feedback, which is a vital leadership action. I can do this by effectively utilizing the 10 steps of corrective feedback, focusing on being prompt and private. One critical step is to ask a team member to suggest corrective measures first, therefore prompting ownership. So it's imperative that I remain vigilant in avoiding unconscious cognitive bias to ensure discussions stay focused on the undesired outcome. And lastly, this process requires that I regulate personal distress to maintain composure. By integrating these strategies on a consistent basis, I can strengthen the effectiveness of my leadership and cultivate a work environment where corrective feedback is both constructive and empowering. All right, systems-based collaboration. So another goal of mine is to be able to effectively apply leadership laterally and upward to influence systems-based improvements for patients who are non-diabetic and overweight or obese and using GLP-1 receptor agonists for weight loss. So this will help me fulfill the NONPF competency to promote collaboration with multiple stakeholders. I will utilize the STEP SOS environmental scan described by our text that aids in identifying any structural changes across political or economic variables. This strategy is needed to advance practice through innovation, and additionally, collaborating with organizations such as the AHA is vital in understanding and influencing the larger healthcare system. So therefore, by engaging in these evidence-based practice strategies, I can improve and strengthen my ability to mitigate system-level change and ultimately improve outcomes for patients who are navigating weight management therapies. All right, so challenge and commitment. So the primary obstacle I foresee is overcoming low commitment from capable but disillusioned stakeholders. So this requires continuous use of inspirational motivation or transformational leadership that demonstrates an appealing, positive vision that promotes persistence. I am obligated to actively protect leadership voices from below, or adaptive leadership, which ensures that even antagonistic members are heard, as their criticisms may help refine the team's path. And my commitment is to view each and every member of the team as an in-group member, and to provide the individual support needed for each one to reach the highest commitment. So my leadership journey is a continuous, ever-evolving process of self-adjustment, intentional communication, and a dedication to my team and patience.